So for those of you who don't know me, I'm Ruth Knight, and I've been one of the research assistants on the Converge evaluation project, specifically working with Converge students or mental health service users. Before we hear from our speakers, I thought we'd just run through what the findings around health and wellbeing have been so far in the project. So basically, we found that Converge does have a positive effect on the wellbeing of both Converge students and university students, and it helps them to develop a more nuanced understanding of mental health. Instead of me just talking at you, I thought it would be better to use quotes from our participants. So this is a quote from a Converge student from York St John University, and they said, "As far as mental health goes, there were times when it was Converge that was keeping me going. There are times when I really didn't want to get out of bed, had enough of all this, had enough. And then I would think, well, not today, it's university day. Get up, get your dicky bow on and get yourself smartened up." And I would do that, and so it sort of pulled me out. And this kind of sets the scene for the rest of the results under this theme that sometimes it's just about small steps, and for some Converge students, just the impetus to get up and come to Converge is enough. We also found that creativity, in particular, was having a positive effect on wellbeing, and it might be related to the way that students are able to explore their experiences non-directly through creative expression, and also it might be something linked to catharsis as well. So this is from a university alumni who worked with Converge when they were a student here, and they said there were so many therapeutic benefits from just being a part of the theatre company out of character. And because a lot of the work that they did was about their own experiences, being able to get those out and talk about them, but in a more creative way, was so beneficial to them. They would explore them in so many different ways. Nick Rowe talks about obliquity, so sometimes the way Converge works is by not coming at a problem directly, but by kind of veering off to the side. We did find that our participants thought that Converge was quite different from mainstream mental health services, and often Converge students preferred their time with Converge over and above their time with mental health services. But there was also a large group of students who really valued having the support of the two services in parallel, so being a part of Converge whilst at the same time receiving help from the crisis team or the community mental health team. That was really helpful for them. And this is a quote taken from an interview with an external partner who said that people who are in the service system are often trapped by it because of its complexities and how hard it can be to navigate. And often it doesn't work in a very person-centered way. And lots of our Converge students that I interviewed over the last year or so really talked about the way that Converge was different because it was about them. It was person-centered, they were leading what they wanted to do, and there was less of a power dynamic. Lots of people that I spoke to talked about little steps on the road to recovery and how doing just small things helped them to better their mental health. So Converge supports students' wellbeing by providing an impetus and also the motivation to be part of something and engage with something. This is another quote from a Converge student from York St John who said, "I think that it gives me a reason to get up on some days where I would normally be feeling a bit lost. I still have mental health struggles, but then I also have lots of chronic illnesses as well. It just definitely gives you a sense of purpose. And I guess when you're feeling a bit in a funk, then it's good to have that external motivation to be like, right, get up, you're going to go and do this. And by the time you come home, you usually feel better anyway." So you're probably sensing a theme that there's something about these small steps that Converge is supporting people to take that has a really big impact on their lives. And then finally, this is the quote that I remember the most from all the interviews that I did. And it actually comes from a storyteller coffee morning. So our Converge storytellers were Converge students who did autoethnographic work. So they made art about their own experiences with Converge. And in this session that we did, we were making zines about Converge, so little magazines, comics about Converge. And this person, a Converge student from Northumbria, was explaining to us what their comic was about. And they said, "That is a wee picture of a shovel. I'm telling myself to dig deep, and it says there, do one thing, just one thing. Could be wash a dish or check your emails." And for me, that really stands out as the ways that Converge helps people's well-being might not necessarily be in grand sweeping gestures, but is more likely to be a a continuity of small steps that helps them get to where they want to be. Right. But today's conference is about hearing from other people, because we've been doing this for 2 years, so we're kind of bored of the sound of our own voices. So I'd really like to invite some of our speakers up to talk. So I'm going to invite Professor Divine Charura to come talk to us first, if that's okay. And so Divine is a Professor of Counselling Psychology here at York St John University.
My name is Divine. It's nice to see everyone, and I've really been excited to be invited to say something. I sort of tend to spend a lot of time steeped in reading quite close. And now, somebody who loves to wear dicky bows, I was excited that you started with a quote about somebody saying, right, get up, get your dicky bow on and get going, which is the whole reason of doing it. Is kind of, for me, the evaluation project was, and Converge as a whole, is I feel is innovative, I think is creative, and is truly person-centered. There's many projects across our nations that are trying to engage service users or in inpatient settings or students and so on, but this feels really collaborative and engaging. And I think it offers a unique model for knowledge exchange and community engagement. So that really came across. And the other thing I was thinking about as somebody who's passionate about mental health and well-being is around the impact and the reach that the work has in making a difference. Looking at the sample size, it was really evident to me that the quotes came from, I think I had a sample size of 174 people who were taking part in the activities, and the diversity of the feedback, as exemplified by some of the quotes we've heard, makes for an excellent and strong example of the evidence of the impact on students, on individuals, and I think on families and systems. That was the other thing that was really clear for me. And for people to use words like "it was a lifeline" makes a real difference. As a psychologist myself, and as somebody who started my life as a psychiatric nurse and is passionate and as a psychotherapist, I think having multiple interventions that people can tap into is so important to enhance well-being. And engaging in creative methodologies, for me, is one of those. Engaging with art, engaging with dialogue, that exemplifies what I call power with rather than power over. And it gives that opportunity for dialogue around power to communities, to participants. And I think it's increasingly important in the world that we're living in which the voice of those with the lived experience of mental health challenges or mental ill health is authentically valued. I think in terms of well-being, valuing that voice is so important. And the voiced challenges by the Converge students included, when I was reading through the evaluation, struggling with well-being, difficulties in working through anxiety, depression, panic, isolation, and the consequent impact on well-being and functionality. And therefore, and this little bit I'm going to read to end, because it encapsulates my thoughts about the impact, thus to have a program that has such a positive impact on well-being, a positive impact on personal progression, functionality, and recovery is invaluable. Converge's impact of facilitating and developing both soft, as the evaluation paperwork said, both soft and hard skills in supporting onward progression, and that's to go on to work, whether that's voluntary or in paid capacity, as well as ongoing education, as well as personal progression. I think that's the other bit, is in terms of being a student, often we think about learning and reading, but I think there's something about being a student of life. And as a psychologist, talk about a student of oneself and community and relationships, is to be commended as world-leading and truly collaborative and person-centered. So that was my little summary of what I got from that.
Fine.
Thank
I
you.
think that really calls to, yeah, go for it.
Thank you.
Really calls to something that we found in the project around progression and the different ideas of progression that there are. So Divine talked about the progression onto academic courses or work, but also there's this progression for the students themselves of being part of a community and just belonging to something, and that is equally as important when we think about progression. Brilliant. So I'm going to ask Leon to come talk with us next. Leon is part of Creative Arts and Mental Health community organisations. Got it right this time.
That's right, yeah. So I'm neither an academic nor am I from a medical background, but I do work in 2 creative community arts organisations that are very much focused on individual and community wellbeing. And I've actually worked with Converge for maybe 5-6 years. So when the sort of evaluation came through, I was a little bit, I hope this says what I think it's going to say. And it did, because I know that Converge works. I know the impact that it has on people. So reading the evaluation just confirmed for me the huge impact that Converge has had over the last, how many years is it? It's a long time now, isn't it? Yeah. So the first thing that came through really strongly for me was the absolute fundamental power of creativity to transform people's lives. Around well-being, around mental health and well-being, around social inclusion, around skills, around confidence, around community, around the ability to progress into other avenues of life. That when you experience poor mental health, so many of those things, those avenues are closed off to you. You don't get those things. So to use creativity as the vehicle for that to happen, everything that the people in the evaluation was saying, that really shone through. And it wasn't just that old kind of idea that taking part in creative activities is therapeutic or anxiety reducing. It is transformative. It helps you build relationships. It helps you explore yourself. It helps you connect with others. It places you within a community in the wider world. And that's what Converge has been doing. And in a way, that kind of thing actually is going on in other places. That happens in my organisation and organisations that I work with. But what Converge has done has really reinforced that kind of learning. But what is unique about Converge, I think, is its placement of that within a university context. Because there's something about, specifically about learning and mental health and well-being, that if you're not well, you don't engage in learning, you don't have a future, you don't feel that you've got that capacity to change. And providing that capacity to learn and an opportunity to learn in somewhere like York St John's, with the facilities, the staff, the knowledge, the progression routes, all of the stuff that comes bundled up with the university experience, to people who would normally be denied that, that is incredibly powerful as well. So that combination of the transformative power of creativity on people's lives, well-being and opportunity, and the actual specific skills that the university brings to that, I think are a magical blend. And I guess the last thing I sort of touched on, or wanted to touch on, was there was a lot of talk this morning about the kind of reciprocity of kind of knowledge sharing. It's not just about a university or the staff or the students passing on their knowledge to the participants, but it's also about learning from the participants, helping the participants to teach each other, to teach the staff, to teach the volunteers. Knowledge is a sharing process in the round, and that's really important. And I'm really kind of excited about the possibility of how people like volunteers or service users, participants, whatever you want to call them, at Converge can go out into the wider world and share that. I would love to see some of the volunteers and participants here come over to Orb and run a theatre workshop and spread that knowledge and way of working and that understanding. I think that would be fantastic. So more of that, please. But yeah, Converge, well done, brilliant.
Thanks, Leon. I think that touched on something really important that we haven't spoken about yet, which is a lot of Converge students said that the big thing that changed for them as a part of Converge was just being able to see a different future, just the capacity to see a life that they might not have imagined previously, and how transformative that is for people. Okay, so our last speaker today is Dr. Steve Wright, who is a psychiatrist within the NHS, giving us a different viewpoint.
Thank you. Yeah. So I suppose when I'm a psychiatrist, I have other roles really, but I'm essentially a psychiatrist. Somebody has to do that, I'm afraid, but it's actually given me, it comes from, so I have a medical background, but actually since I qualified, I've probably gone from doing something that affects almost nobody in terms of genetic research to working on something that affects everybody, and that's been a major part of my own journey, really. When they told the medical profession to roll their sleeves up and take their ties off, they obviously missed an opportunity to encourage dicky bow wearing at that point. But, I've been involved with Converge on and off. I work in an early intervention team. I was fortunate to lead a couple of expeditions to Trieste, study visits, where Converge was very much at the heart of looking at how communities, connecting communities, can be a therapeutic opportunity. And I think that's really what Converge has shown me all along. It's around recognizing that within a community we have the capacity for people to take control of their lives again, and that it's well beyond any single profession, and it's well beyond the remit of evidence-based interventions. And evidence-based is what the NHS gets stuck on. How do you develop new strategies when they're either very difficult to research or they are too complex for the pen pushers who are pushing around the funding? So an example of that is around drama. The arts are really creativity. We know that doing anything is better than doing nothing. Doing something new is better than doing repetition. And that actually there is a biological basis to that in terms of using different muscles in different ways, in terms of thinking, doing things that you've never done before in an artistic way. But the story that brings it home to me is when I was in training and I was in a family clinic, I suppose you call it that, but it was an experimental approach. And I was working with an experienced social worker who was also just finished training in drama therapy. And we were sitting with a very troubled young teenage girl and who wasn't having any of it, really. She wasn't having any of the CBT or anybody really, which was fine. And I would have joined her there if I was the teenager in the room. But getting nowhere, I looked across at Drew and he said, well, let's try something different. And to fast forward 90 seconds, this girl was directing the psychiatrist and the social worker in the lead roles for her favourite movie, which unfortunately was Dumb and Dumber. And she had complete control over the process. And it really brought it home to me. I'm not telling you who was dumb and who was dumber either, but it was a fascinating experience, and it's something it's brought with me, and I hope I've been an ally of Converge ever since. But it's certainly my response would be that there is so much that you've already shown how to use community resources for the good of the people who need it. And my follow-up would be, we need more of that, and we need more investment, and we need to break out of this shackle of only things that have been researched in randomized controlled trials have any value, because we know that's nonsense, and we need to be listening to what people want and not just to what the clever scientists are telling us.